and it's looking at the patient very much as a whole rather than looking at just their medical problems. So we'll often find as GPs that other areas of patients' lives will be impacting on their medical or mental health problems. But we're probably not very good at addressing those things as GPs on our own. We'll kind of focus in on the medical problem, things that we can fix, treat with medication and referrals. And we'll often either not necessarily ignore, but things that we know that we can't really help with, we'll leave out. With the flow approach, we have a much longer appointment with the patient over a few sessions ideally, find out a lot more about the patient and about other areas of their life, not just their medical problems. This allows us to then sort of go back to the team and look at ways that we could help with some of those other problems that they're having, which can then actually really greatly improve their life in general, but also their health in general, because we'll find that a lot of these other problems are impacting on their physical and mental health. In doing the initial consultations, which we called the What Matters to Me conversations, we had a flow toolkit that we used. This I found really helpful because it just guided me through the consultation with the patient and gave it some structure. Because if you're just asking that question, what matters to you, that's pretty open-ended, and it gave a real good guide in terms of what to go through with the patient to try and get out the important bits that were going on in their life at the moment. Seeing the benefit that it's had to my patient and actually what they're going to get from it, I think that will then mean that they present less and will then lead to needing less of my time. So that's helped from that concern. Really hoping that other GPs are keen to get involved and use the approach, because I think there's so many patients that it could benefit, and it's a different and fresh approach for GPs to use. So I'd really hope that other people want to get involved, because I think it would really benefit them and their patients.